Thank you all for joining our webinar this evening. I want to start this webinar by saying I am proud and very grateful for the work done by women in Scotland throughout this COVID pandemic. We have kept the economy moving, kept society safe, and kept our shelves stocked. Every woman has had a balanced commitment to work, the public, our own families. This pandemic continues to be a struggle for many, but we will come through stronger as long as we get organised in our workplaces and keep fighting for our rights. I am a convener in the whisky industry and have been for 36 years. I'd like to share some of my own experiences and the experiences of women in my industry. I know that the whisky sector isn't a female-dominated industry, but I can tell you it was a woman who stepped up during this crisis. As a shop steward, I confronted one of my directors of my company because they were doing nothing. I told him he better come to the shop floor and look the workers in the eye. I asked him, what's more important, a bottle of whisky or the lives of our members? And to give him his due, he did come and meet us. We got our company to shut down for 2 weeks before the pressure from other companies forced them to reopen. We had only started safe systems at work in the workplace before lockdown. And as a union, before we could return, we needed the areas to be safe and ensure the factory was deep cleaned. We risk assessed everything and the company did what they were told. We negotiated extra money for those willing and able to return to work. Double time and time and a half for most people. This extra money allowed us to support our families where COVID had cut household incomes. We wanted to support the survival of our industry. It was women who stood up and volunteered and took on these shifts. But now, after all that, the company has changed the shift patterns that were most popular with the women, and now they are worried about their jobs. How can it be the women who kept this industry going throughout the COVID are now the ones being left to worry about their jobs? And it's the same across Scotland. Women have kept society moving, and we have also been more at risk of COVID and continued to be the lowest paid in industry in the country. Women workers have to fight tooth and nail for safer workplaces. It is hard to believe now that there was a time when care workers were being told that they didn't require masks. But we won't forget that they only changed when 1,000 GMB care workers spoke up and demanded PPE they needed. They stood up and were counted, and the Scottish Government finally listened. There has been so much pressure on women to keep others safe, while also worrying about not taking the virus home to our families. We have been keeping the economy and society moving, while also supporting our loved ones who have lost their jobs. COVID has been tough for everyone, but has been an incredible challenge for women workers. I am angry at how, and especially low-paid women workers have been treated throughout this pandemic, but I am also determined that we never let a single politician forget that they clap for these low-paid workers, and now more than ever, it is vital that women join a trade union and get organised in their workplaces. I am proud to be a union convener for 36 years, and I've seen the power when women get organised. So that society woke up to the value of women workers, and it's now our job as trade unionists to never let them forget it. Solidarity, sisters. Thank you for listening. I'd like to move on, and before I introduce our 5 speakers, there's a couple of points I would like to make clear to the webinar. There will be questions and answers around 7:15 to 8 p.m. tonight, and I encourage you to use the Zoom chat box for questions to the panel. It's in the webinar. I would like to introduce my first speaker, Emma Rich from Engender. Thank you, Emma.
Thanks very much, Brenda, and I'm really delighted to be here tonight with the STUC Women's Committee to talk about this really important issue for women's equality and rights. I'm just going to share some slides with you and hope you can see these. Okay, so the very first thing that my organisation, Engender, wanted to communicate to government and to others when we started lockdown was that we actually know quite a lot about what normally happens to women during a pandemic. And what we saw during Zika, during Ebola, right around the world is that women are at higher risk for all the reasons that Brenda talked about. Women are more likely to be healthcare workers, domestic workers, carers, more likely to be doing the shopping and housework, and more likely to be using public transport. But what often happens during pandemics is that spending and programs that are oriented towards women and girls get deprioritized. And we see a reduction in spending on women's health, especially reproductive health. Girls' education becomes less important, and we also see less spending on equality programs. The third thing that happens is that focus on women and girls reduces. And so politicians and employers, as Brenda described, often start to introduce things which they think are generic, but actually don't meet women's needs and are particularly unlikely to meet the needs of Black and minoritized women and disabled women. And politicians and policymakers often stop making the best decisions with girls and women's rights at their heart. Engender thought a lot about the unpaid work that women were going to be doing during COVID and issued some really strong warnings about the likely impact on women's lives and women's equality of this. We knew that before COVID, women did 68% of all of the housework and 68% of all of the care work. And that's based on time use diaries that tell us what women do day to day and week to week. We all know that balancing work and family life can be a juggle, and that for a lot of women, being able to do paid work at all is really dependent on whether transport works, whether there's a nursery, school, grandparents, aunts and uncles, friends providing unpaid care, a good after school club, and whether they can get to the supermarket before or after their working day. And during COVID, all of these things were undermined. And so what we've seen during COVID is that politicians and policymakers haven't taken enough account of the day-to-day juggle that women have to do. And so what we've seen is a massive increase in the amount of care that women have provided. And we've seen care packages reduce right across Scotland. We have seen a massive increase in the number of unpaid carers by about 239,000. So we now have over 1.1 million unpaid carers in Scotland, and most of those are women. Women are also doing more housework and more childcare. And that's even in households where men are furloughed and are not doing paid work. And as a consequence, women are doing less paid work, about 2 hours a day less paid work on average, just because somebody has to be there to do the caring, to supervise the schoolwork and take care of the household. And that is adding up to, at the moment, £50 million a day in Scotland, the cost of all those 2 hours of work that aren't being done by women. So what's going to happen next if policymakers and politicians don't get a better grip on what women need during the COVID recovery and future lockdowns? Well, we know, because women have told us, that women are running out of toil, annual leave and flexi time that they've used to juggle paid work and unpaid work. And if we move into a pattern of regional or sectoral lockdowns, then it's very likely that some women at least are going to have to stop doing paid work. And if that happens, given the social security system we have in Scotland and the UK, it's very likely that we're going to see men doing paid work and women caring as more of a reality, as well as a stereotype. And as a result of that, women's equality and rights are going to reduce, and the gender pay gap is going to widen. So what can trade unions do about this burden of unpaid work? Well, we need to start seeing unpaid work as an economic issue. Economists who are feminist have long called for a reduction in unpaid work, a revaluation of unpaid work, and a reallocation of unpaid work from women to the state. And in doing that, we need to see good quality caring jobs, really well paid, and a reconsideration of how the state delivers some of those universal care services that we're all going to depend on at some point in our lives. Thank you.
Hi, sorry. Thank you, Emma. That was really great. I would now like to put you on to our second guest, who is Wilma Brown from Unison.
Good evening. My name is Wilma Brown. I'm a Unison activist and I work in the NHS. I work in the Health Board in Fife, here in the Great Kingdom, as they call it. I'm really, really pleased to be standing in for a colleague who had to step out last minute because of women's issues, because things that have come up in her home life are more of a priority. Anyway, I'd like to talk about how things are in health. I don't have a fancy presentation or any prepared statistics, but I think Emma has set out a really good pathway in terms of what we're here to talk about. Obviously, in healthcare, as people who use these services, you realise that they are predominantly female run, and these women will be doing all of the things that Emma told us about, all of the unpaid care, etc., that they do every day for their families and their children. And then they come to and have to come to work and worry about the impact of either working directly with COVID or be in a hospital or a care delivery centre where COVID could be there and it might not be, but also we know that there are actually positive cases. And we had lots of women working right at the front line, red areas as they called them. Hospitals were zoned and people knew where they were going into work. And right at the beginning, things were very, very difficult, even in hospitals, in terms of women having PPE, personal protected equipment. And they were fighting, or we were fighting on their behalf, members coming to us to ask us if it was right that they didn't have this equipment that they required. particularly when we weren't sure when people were being brought into hospital, whether they were positive or not because they were unwell. Women were working with these patients without PPE and continue to within the care sector, perhaps not as prevalent in the hospitals, but definitively still going on in the care sector, where PPE is not as easily accessible as it is in the hospitals now. But we had politicians standing up and telling us that we had lots of PPE, that we had enough PPE. At one time, the Director General for the NHS in Scotland said that we had easily 6 weeks of PPE in our warehouses ready to be given to staff. And I called that out on a daily basis within the hospital. And in fact, this wasn't true because I had senior nurses within ICU and frontline wards that were phoning up and emailing and messaging me and saying, we've only got a few hours left of this PPE. We don't even have enough for the next shift coming in. And initially people were sharing personal equipment that is single use or certainly only for the use of one person. So these became the big problems that women were living with on top of everything else that they deal with on a daily basis. And it was very difficult for them to continue knowing that they're putting their children into care centres. So schools were done, but frontline workers were being given the advantage that some saw it was an advantage that they could put their children into a care centre so they could still come to work. When I'm sure these women would have ideally loved to have battened down the hatches like many other people could have and stayed at home. But they had to do that, and they put their children and themselves into these heightened risks of going into different areas, different care centres, to make sure that they could continue to come to work to care for the vulnerable and the ill in our societies. And they did that every single day. Our absence figures in hospitals, for example, went down during COVID. So more and more people were not taking time off if they felt unwell. They were actually still coming to work, probably with a greater sense of responsibility to make sure that they were there on the front line looking after patients. And all of that is very difficult for women, and we need to always be making sure that we can get things to them when they need them, and for them take away a bit of that worry. And it struck home to me when I was doing a walk around with the Director of Nursing for our health board. We decided to visit the ICU unit and speak to the staff who were delivering frontline care, to thank them for everything they were doing, to tell them that we were supporting them, that we were there for anything they needed. And I remember sitting in the coffee lounge of the ICU unit. Obviously, we couldn't go into the unit itself, but when the girls, and I say girls because everyone that came to, and there are men that work in the ICU, but they are outnumbered. And when the girls came for their break, they'd taken off all of their PPE, they'd done all their hygiene issues, you know, they'd washed their hands, they were clean to come into their break now. When they came in and I saw they were some of them were young, very young, others were a bit older, had children at home, all of that kind of stuff. Their faces were marked red with the masks, with the hats, their wrists were red with the tight gloves that they need to wear to secure the infection control measures, all of those things, and their eyes were huge. They were terrified. They were terrified about picking this virus up and taking it home to their families, because what they were seeing was the very worst of COVID and the effect it was having on families. And they weren't just picking up the normal working issues of working in an ICU. They'd actually become the eyes and ears for the patient, because they weren't allowed their family in. They weren't allowed any relatives near the hospital at all. So they became then the emotional support as well for the family at home, who were calling in every day to see how their family member was, and also for the person in the unit to give information back to the family. And that happened in wards and departments too, and care homes. But in ICU, where people's lives were on the line, these women were doing all of those jobs and scared in case they didn't have the correct PPE. And I know as a nurse myself that that would have been very, very difficult because you can't make those choices once you're in that unit. You can't say, I'm not going to do this or I'm not going to do that. When you've got a patient sitting in front of you who needs your help, you will continue, whether or not you've got the correct PPE, whether or not you use a piece of kit that you know is probably not the best, is not the most ideal. And I think the strain that that has put on women has been phenomenal. And I don't think that we realise the impact of that for many, many more months to come. And indeed, going into another peak, not the same as the first one, not as many people being taken as seriously ill. But we won't know the impact until all of this is over. And these women come forward then and they'll be exhausted, they'll be broken, they can't do it anymore. All of these things that we're left to pick up. So I share the points that have been made earlier, that we need to find ways to reduce the burden that women have during their workplace, to make sure that when they go home, they are the person they want to be to look after their family. And it's a very, very difficult balance for people, for women who work in healthcare, in care homes, care sectors, where they're going into homes and usually people's personal homes as well. They don't know who's been in that house before them. So all of this is done on their own assessment, their own judgments, to make sure that they're doing the best they can. And they'll continue to do that. And that's what women do. They continue to do everything that everybody expects of them. I could go on about this for hours. There are many more people waiting to come in and speak. So I'll end it there, and I'll be more than happy to pick up any questions in the following session. Thank you.
Hi, thank you, Wilma. It's great to hear what really happened on the front line from somebody so experienced. My next guest speaker is Hayley Maxwell, and Hayley is involved in violence against women workers and worker stories.
Hi, can you hear me okay? Yeah, nice to see you again, Brenda, and thanks for inviting me along. So my name's Hayley. I work with women who have experienced sexual violence principally, and this pandemic feels like a moment where violence against women in all its guises has become at the forefront of public awareness in a way that I've never really seen before. As we know, women experience pandemics in a way that is magnified. So although men have higher mortality rates, women's health outcomes are much worse. This can be to do with lack of access to reproductive care, can be to do with lack of access to health screening for cervical and breast cancers, and it's also to do with all of the issues that Emma mentioned in the first presentation about the increased burden of care, and Wilma pointing out that women are at the front line working with vulnerable people, so are very much at risk of contracting the virus. And as we know, women with care burdens, women with disabilities, women on low incomes, women who work in the sex industry, women of colour, are all, their risk is intensified and is probably the most significant out of the whole population. But in terms of sexual violence and violence against women, which is my special subject, I suppose, the conditions of the pandemic have really intensified some existing issues, but have also, I think, opened the way up for some interesting solutions, or maybe show how things could change. So at the moment, you know, children and adults who have been living in lockdown or been confined in their homes for long periods of time may find that their experience of domestic violence is intensified. However, we spend 50% of time at home, 50% of time at work. And for some people, the home is a place where they feel safe, and for others, the workplace offers a lot of respite from their conditions at work, if it's perhaps a colleague or a boss that is causing them distress. So being able to work from home for many women that I've spoken to has actually been really wonderful. It means that they have been able to stay in a place that they feel protected from harm. They don't have to find themselves in situations with colleagues or people in the community that have continued to harass them, who are someone that they perceive as being a risk to themselves. I spoke to one young woman who talked about having to deal with a colleague on Zoom chats for work, whose behaviour was moderated by the presence of his wife and children at home. So some of his aggressive behaviour was reduced, and that made her working life so much easier. However, this boundary between the workplace and the home, its dissolution, has meant that work can become part of the way that someone is maybe terrorised as part of domestic abuse if they're experiencing that in their home. So the link between technology, surveillance and restriction to movement has really equipped perpetrators with a whole new way to continue to harm women in the community. So whether that is through using someone's work, so preventing them from performing work at home, being able to get access to maybe private work files and using that to have leverage over their partner, monitoring the way that someone speaks if they are having to attend lots of meetings on webcam. If we think about work and women's access to work, especially well-paid work, as being something that allows someone to be empowered, to have some autonomy in the world, and to be independent, when that moves into the same realm in which they're most disempowered and most oppressed and most prevented from being themselves, that can really take away like the only sense of safety and personal independence that a person has. So this said, being aware that work is now taking place in home allows employers to maybe think about ways that they can intervene and also create opportunities for disclosure. So for example, using risk assessments or performance management as an opportunity to check in and see what has changed for your worker. If there's been a really significant change in their ability to participate at work, for example, they're not having their camera on at all in meetings, if their productivity is very, very low, if they're very eager to get back in the office, that might just be because they're fed up in their house, but it could also be that there is some sort of risk at home. So building in the risk of domestic abuse and acknowledging that as part of many, many women's experiences. When you're doing, equipment assessments for women working at home is a pretty sensible option and something that could create a conversation. At the moment, I've noticed that Boots the Chemist have set themselves up as a sort of refuge space. But the issue there is if you have coronavirus, if you're self-isolating, can you go or would you feel okay with going and announcing that you're experiencing domestic violence? We know it takes women many, many times before they will leave a situation that is very unsafe, and only providing a space to be able to kind of go and announce your situation is not enough of an intervention. Women need access to well-funded services. The ones that I work for at the moment have always been overstretched and have very small budgets, and we've had to adapt in lots of different ways to be able to continue provision of crisis care. We are all, frontline workers. We are working in care, I suppose. We're not particularly well paid, and our health and safety has been impacted by having to work with very distressed women and having a limited range of ways to help them. Pandemics don't create abusers, and if violence against women feels like an inevitable consequence of a public health crisis, then there's something wrong with your society. That's kind of all I've got to say on the matter, but I think that all women can join unions, and unions and workplaces can start rebuilding their understanding of what a health and safety risk is by thinking about what is a common experience that women find themselves suffering from at home.
That was great. Hayley, thank you very much for your contribution. I would also still like to ask the webinar to remember to put questions for some answers later, and encourage you to use the question and answers, please. I would like to introduce you to my next speaker, who is Anna Ritchie Allen, who is part of Close the Gap.
Thanks very much, Brenda, and thanks very much for inviting me to speak today. I'm also going to share my screen as well, so you can see a few slides. So I'm just going to give you a very brief overview of the impact that COVID-19 has had on women's employment. And Close the Gap has been looking very closely at this since COVID had started. We know from analysis that we published at the start of lockdown that women are more likely to work in high exposure jobs, and that's just not in terms of exposure to the virus, as Wilma had spoken about, because women are the majority of key workers, but also the jobs that they work in are at high exposure to job disruption. Women are more likely to work in a sector that's been shut down, both those that are still shut down, but also those that have reopened and are affected significantly by physical distancing. And that particularly affects Black and minoritized women, migrant women, young women, and single parents, the vast majority of whom are women as well. We know that many workers have been affected by furlough and across the board, across the UK, although the absolute numbers show that more men have been furloughed. What we know is that younger workers are particularly likely to be furloughed, and the group of workers, those who are 17, that's the largest group of workers that have been furloughed. The majority of those are women. And actually, if you look at the most recent data in Scotland, it shows that roughly the same numbers of men and women are currently furloughed. Women are also being affected by having their hours cut, and that measure that's been enacted by many employers, we've seen that most used in female-dominated sectors such as accommodation and food services and admin and support services. We also know that as an effect of the pandemic is that many women have left their jobs. And at the start of lockdown, we saw a sharp spike in women's unemployment, which was partly driven by women being made redundant, but also, as Emma mentioned, women who were forced out of their job because they had to do more childcare and more care because of the closure of schools and nurseries. So as Wilma was also speaking about, women make up the majority of key workers in a range of different jobs, also out with the NHS in terms of cleaning and retail and nursing and teaching. But as she was saying, obviously, so often these are undervalued, underpaid and underprotected. We're really concerned that women's propensity to be in low paid work and to be in precarious employment has exacerbated their experience of working during COVID. So for those women who have been furloughed on 80% of their pay, that's pushed many of them below the threshold for universal income. And this creates a massive risk of poverty for women and their children. We've been really concerned that there's been no financial protection for gig economy workers, particularly because 3/4 of women working in the gig economy earn less than the taxable threshold. And that's particularly concerning when women are less likely to have savings in the first place because on average they earn less. And low paid work in particular, that affects Black and minoritized women and younger women especially. So Emma spoke quite a bit about women's unpaid work. I suppose just to add to that is think about the restrictions that were placed on accessing the furlough scheme for women. And I think the furlough scheme was a really good example of not considering the way that women engage with the labour market when they were designing the scheme, the UK government. For a start, there was no right to be furloughed. Women had to get agreement from their employers, and the evidence that we've seen is that many women were desperate to be furloughed, but they weren't able to. And although latterly there was a provision to be furloughed based on having a caring responsibility, it was very much an addendum. And as a result, there was a low awareness from employers that there was that provision. And also there was no provision to be part-time furloughed, which many women felt would have alleviated the pressure that they felt as they were struggling to cope with childcare and other types of care. So I just wanted to highlight a couple of particular challenges for women's employment. Obviously, the job retention scheme created, to an extent, a safety net when workers needed it most. But ultimately, that's coming to an end at the end of October, and we're going to be facing with this cliff edge of women's employment. And what we do know is that the replacement job support scheme is entirely inadequate and probably can be best characterised as too little, too late. It's less generous overall than the job retention scheme, but we're really concerned that it will serve as a disincentive to employers to pay for hours that aren't being worked at a time when businesses and organisations are under financial pressures. And we think this is has the potential to hit higher paid workers and lower paid workers differently. So there may be more of an incentive for employers to feel more comfortable about paying higher skilled workers where there's greater challenges in recruiting and retaining these types of workers. But for those sectors that have already been hardest hit by COVID, such as tourism and retail and hospitality, where workers are in lower skilled jobs and recruitment and training costs are lower, there's less of an incentive for employers to join the scheme. Ultimately, it's not going to protect women from redundancies. And we're really concerned that because it's going to be cheaper to have fewer full-time workers rather than more part-time workers involved in the scheme, that's going to negatively, disproportionately impact women workers because they make up the majority of part-time workers, but in particular, young women and disabled women and single parents. Close the Gap does a lot of work with employers, and we've been particularly alarmed, I think, by the deprioritisation of gender equality by employers at the time when we really need it most. Even those employers who had been doing otherwise good work up until COVID hit, it's been really concerning. And I think that wasn't helped by the fact that the UK government and the Equality and Human Rights Commission took the decision at the start of lockdown to suspend pay gap reporting by employers, which did nothing but signal a strong message to businesses that in times of economic crisis, that women's equality doesn't matter. And just one final point to finish up on was around the response. So what we need is some really strong employability and skills interventions, but most importantly, they need to be gender sensitive in that they need to think about women's experiences of engaging with the labour market, and so they need to challenge occupational segregation as a central aim, and they need to take into account women's caring responsibilities and other gendered barriers to the labour market. Thank you.
Thank you, Anna. That was really great information as well. I would like to call on my last speaker. My next guest speaker is Roz Foyer from the STUC General Secretary.
Thank you very much, Brenda. And can I just take this opportunity to thank all of the women that have been participating so far tonight in what is a very important conversation about the challenges that women across society have been facing as a result of COVID, and also as a result of the baked-in inequalities that COVID has simply magnified for many women. If I can just start by paying tribute to Brenda and to both Brenda Carson and to Wilma Brown. I think it's really important that tonight we've heard the experiences of women that have worked throughout the pandemic and throughout the lockdown. Brenda spoke to us about key challenges that she had faced in the food and drink manufacturing sector in terms of getting support for her workforce, a predominantly female workforce that's had to face some real challenges during the period that they were there, and how by sticking together and getting organised they were able to get steps forward and get the payment of extra allowances, double time, etc. that Brenda laid out. But I think also hearing Wilma's account of frontline NHS workers at the height of the first spike of this pandemic really was very moving, I'm sure, for everyone to hear, and actually makes you really angry to think about the risks and the absolute scandal of workers being sent out into caring responsibilities without adequate PPE being made available. The STUC have continued to keep our calls going that those key workers should absolutely have had more than a clap, and we've made short-term demands that there should be an immediate payment of uplift of £2 an hour for all workers who were key workers through the lockdown period and who've kept the country going, but also a rise of the minimum wage to an immediate £10 an hour to take account of all of those shop workers, the food industry workers, the people that have kept our factories going, all of those workers, many of whom have been in poverty pay and without whom we wouldn't have had our elderly and our vulnerable cared for, we wouldn't have had our people looked after in hospital, and we wouldn't have been having food on our shelves in the supermarkets. And we're still waiting for an adequate response, both from the UK and the Scottish governments, to those calls. And I think there are longer term calls we need to look at as well, about how, real lessons that need to be learned about what we value as a society coming out of this, and what really is the important and skilled work that takes place, because the important and skilled work that has taken place that's got us through this has been the caring roles and the roles that require a human touch, and arguably many of those roles that are predominantly carried out by women that have been historically undervalued by our society. And I think we're going to have to take a real look at that going forward and start to really tackle and address that. And I'd like to also thank Hayley for sharing with us her experiences of supporting women suffering from violence and abuse during this pandemic. I think that is something that as a trade union movement we're going to have to look at going forward, and health and safety considerations of really looking at the impact for so many people for whom now home working is becoming more of a normality. And that's certainly something that the trade union movement has been having conversations about, looking into how we can support workers who are going to be at home. We've had many tales of employers without any consultation or by your leave with the workforce moving to completely home working models with no consultation. And as much as for many workers home working can be a really good viable alternative, there are also many workers for whom home working is not a good viable alternative. And guess what? It tends to be those workers on the poorer jobs that don't have the space at home, that don't have the ability to be able to have a good work area that enables them to be able to homework in a viable way. So these things need to be looked at and they need to be addressed by us. But I think the idea that we need to take domestic violence into account as part of that overall risk assessment of home working is a very welcome assertion, and one that we certainly should be looking at. And I'd also like to thank Engender and Close the Gap for the really useful slide presentations. I think what you've done is that mixture of real lived experience that we've had from our frontline reps tonight, paired up with the research from those organisations, really does show us the whole gambit of areas where women have had to face tougher challenges through this pandemic. And you know, the way that we're going to be able to change that, yes, we can lobby governments, but as Anna quite rightly said, what we are seeing, and we're seeing it in policy terms as well, is a deprioritisation of equalities. And as austerity and the economic impact of the virus starts to really bite down deep, we're going to start to see that coming to the fore. And you know, this week, there's a number of reasons why this week is an interesting week. You know, it's Challenge Poverty Week, and sadly we're living in a Scotland where the mortality rates are at their highest. You know, we have the lowest age of death in Western Europe. We have the highest rates of drug deaths in Europe. We have the highest in-work poverty. Child poverty is at 25%. These are record levels of in-work poverty and child poverty. These are not a track record that we can or should be proud of for Scotland as a country. And, you know, we also are sitting here looking at 10 years of the Equality Act. And sadly, you know, if we look across public bodies in Scotland, equal pay in public sector certainly hasn't been fully addressed as much as it should have been. And there is still a big amount of work to be done for trade unions and for public bodies to really fully address the equal pay imbalances that exist across our public sector. And I think that really demonstrates that, you know, again, we've had 50 years of the Equal Pay Act and we still have a pay gap, and it really does demonstrate that laws alone and leaving things to governments alone are not going to make the difference that we women need to see made in our society. The difference is only going to be made if we come together and we get organised. And that goes right back to what our fantastic chair, Brenda, said right at the start of this session, that, you know, women need to come together. We need to get angry and we need to start organising and start forcing employers, government, budget holders, decision makers at every single level to start to prioritise our issues. And that's not going to happen without a fight. It's not going to happen without our collective pressure. And I, for one, certainly want to work with all of the women in our movement to make sure that we start to build strategies that are going to take that approach forward. Because if we're really serious about rebuilding back a fairer economy, that needs to be an economy where women are at the heart of it and where they are treated equally. Thank you.
Thank you, Roz. That was a great contribution as well. I would like to thank all the speakers for their contribution and for being very informative to all of us. This has given greater understanding of what's happening in various industries. And your questions are now firing in, so that's really good. And I would like to ask the panelists to now answer some of the questions that's going forward. So, sorry, was that? So I would like to thank our panelists for their contribution. It was very informative to all of us, and it has given us great understanding of what's happening in various industries. And now I would like to ask the panelists to answer some of the questions and answers because they're all firing in now. And I'll start off with a couple of the questions. The first question I can see is, are you worried that cuts to services will make things worse for women? I don't know if anybody would like to answer that. Roz, thank you.
Thanks, Chair. Yes, I mean, we've actually just launched a document entitled The People's Recovery, and one of the points in that document, which is a report about, you know, economic recovery and what needs to happen, but one of the key points that we've made in it is there needs to be a proper funding of local government, because at the end of the day, local government funds an awful lot of services that are very, very important to vulnerable people. And you are talking about things like your women's refuges, you're talking about things like your citizens advice bureaus and all of those different services. But more than that, you know, your social work departments, your people that, you know, are keeping an eye on folk and monitoring folk that really can be in quite desperate situations. All of these areas have not only just are up for getting cut now, they've been getting cut non-stop for the past 10 years. And you know, it really is time that we start to put some serious funding back into these areas, because this is a time more than any other when those sorts of services for society's most vulnerable are really going to be needed. You know, just in terms of care, I know that for the first 2 months of the pandemic, I'd just started my job, which is quite a daunting task to become the STUC General Secretary, but as well as having my 2 daughters at home, you know, I know that 40% of Glasgow's people who normally got cared for, 40% of care services had been pulled back. So I was also looking after my elderly mother, who's 89 years old, and making sure she was bathed and fed and everything else. But, you know, there was a lot of people out there who got care services withdrawn just like that. And that needed to happen because those workers needed to isolate in a responsible way if they were displaying the symptoms. But there was no give in the system to give that extra support that was needed. So it's a really important question. Sorry for taking so long, Chair.
Hayley, do you want to come in on that question as well?
Yes, please, Brenda. Just to add to what Roz has said, I think it's also about community services like libraries, community clubs for like children, whether that's like the Brownies or football teams or any of these less formal childcare systems, or community groups in general, which is where women meet each other, get support from one another, are able to have that reduction in isolation if you're at home with your children all of the time. I mean, I know that people love their children, but it has a huge impact on your mental health if you have this like paid work burden and a care burden and no way to act in the world as an independent adult. But access to leisure facilities, cultural venues are all ways that women can feel empowered, can increase their skills, and cultivate a sense of well-being for themselves and their children. And if they don't have access to any of those things, their lives become very, very small and their function quite limited.
Thank you for that. The next question, I think, is looking for Anne Close the Gap and Emma Engender to answer. How can women's policies organisation and third sector organisations more generally help be the trade union movement? I think it's asking Emma and Anne.
Shall I go first, Brenda, or to sleep in? I mean, I think Engender really wants to have a good, strong sisterly relationship with the trade union movement. I was just saying to Erin that this is actually a bit of an STUC reunion tonight because both Anna and I worked for the STUC, so it's really nice to see so many familiar faces and names in the chat tonight. But I think the things we can do, I mean, I agree with Roz entirely that you need to organise. No one's ever given women their rights. Men haven't given women their rights out of the kindness of their hearts. We organised together in feminist movements, in trade union movements, and we took our rights and we secured the small measures of equality that the sisters who came before us secured for us. So I think the short answer is we work together. I think one thing that Engender can provide to the trade union movement is some information, perhaps, as others have mentioned, like we do research, we gather information together, we advocate and lobby government. So we're always wanting to hear from women about their lives, because our work should be rooted in women's lives and experiences. So I think the short answer is sisterhood, working together, coming together to struggle for the things that we all want to struggle for.
Thank you. And Anna, do you want to come in? No?
No, just to add to that, yeah, I would just agree with everything that Emma has said. Close the Gap's got a long history of working with trade unions. As Emma said, Close the Gap used to be hosted by the STUC, and we certainly see, in terms of trying to change employer practice on women's equality, as trade unions being integral to that. And some of the best examples that Close the Gap has been involved in is where trade unions played a key role in influencing change at the workplace level for women workers. So yeah, I think it's really difficult to do that without that solidarity and the more collective approach from everyone who's involved in the workplace.
Thanks very much. The next question is for organisations funding the Scottish Government. Do you feel your funding is potentially under threat by what is over the horizon of dealing with COVID-19? Women in the movement, do you feel the Zoom chats is more an exclusive way to get women involved in organising your workplace? Hayley?
Yeah, Zoom's been a really good way. I think all these technologies have been really helpful in helping workers communicate with each other and share common concerns, especially if you've got staff that are on different shifts or maybe working outreach or maybe don't have the chance to see each other in the office that often. And as well, you know, a lot of places are operating on skeleton staff. So people's experiences aren't being collected in a common sort of way. So we've been able to have the workplace rep for my workplace, and we've been able to have all of our union meetings online, which has been really great. It's all women, so it's been very orderly. I think it's been a really good opportunity to make sure that those conversations are accessible to people who maybe wouldn't be able to if it was in our premises.
Thank you. I'll see if there's any more questions. Another question is, what would you say to women that feel tired of fighting for equality and feel their voices are not taken seriously? Anybody like to answer? Another one is, why should women join a union? Will it make any difference?
And I think Wilma was wanting to come in there. If you want to come in before me, Wilma, I wouldn't mind saying that, but I'd like to hear from you first.
Okay, so on both those questions, really, what I would be encouraging people to do is to join the union in the first place. I do think that there is certainly within healthcare, there's a lack of visibility of the reps around, because obviously everybody's having to keep to their own particular areas, but we're always available on all different formats. You know, we can be contacted through Facebook. We're trying to get out there as much as possible. And I do think while Zoom has been very good and all the different teams and all of that has been very good for people staying in touch, that's okay if you've got that technology. So a lot of our low paid workers, our domestics, catering assistants, porters, you know, all of these people don't necessarily have the technology to be doing this, and they may have a smartphone. Most people do have these days, but they can't afford the levels of data that they might require for taking part in big chats or webinars like this. So it's very difficult for people to remain in contact. And I think the areas where people who were starting to get a bit more tech savvy, for example, within our hospital, Costa does free Wi-Fi. They might have gone and sat in the Costa, not necessarily having to buy something, because we made that a complete ruling. You know, you don't have to buy something to sit in that area in our hospital, but they were going there and they were using their data to be able to do lots of things online. And I think people have actually lost a lot of that, and it's been very difficult. So the importance of workplace reps is even more important now than it's ever been. We need people in every workplace. It's not always possible, and the rest of us try and cover those gaps, but it's really difficult. And that's what I would be saying to people: get into a union, even having workplace contacts so that they then can contact the reps. We've got to kind of tighten up that network to make sure that people do have the support when they need it.
Thank you very much for that.
Brenda, if I can maybe come in on a couple of those questions as well. I mean, I couldn't agree with Wilma more, and I know that, you know, our reps that have been in the health service and local government in particular, the strain that's been on reps throughout this period, you can only imagine the amount of health and safety inquiries, very worried and concerned members, you know, all of the work on risk assessments and everything else that's had to be carried out. We really do need as many people to step forward, and particularly women to step forward and play a role. And we realise the care and responsibilities and everything else, but in some ways, you know, we just need to start thinking outside the box a wee bit about this. Like, how can we knock down some of those barriers about digital inclusivity and things? You know, why shouldn't trade union branches be using their money on giving out data sticks to our members and activists to make sure they can participate? Because in some ways, once you get over that hurdle, actually, we've got a really inclusive forum here, particularly actually for women. I've heard anecdotally that we've got a lot more women activists attending certain meetings than we've ever had before in various unions. And I've also heard about lay member committees since, you know, digital platforms have become the normal mode of communication. You know, committees that used to only meet quarterly are suddenly meeting weekly. And actually taking forward a very action-oriented agenda rather than a much more kind of formalised policy type agenda. So I think we've got some huge opportunities here in some way. And, you know, people have never needed unions more than they do right now. We've got a moment of relevance that we really need to push forward on, and anything we can do to make things more inclusive and actually, you know, get more women to have the confidence to come forward and participate is really, really to be welcomed. So, you know, I think I'd certainly be happy to do whatever I can to help take that type of work forward, and I'd be very happy to talk to the Women's Committee about how we can maybe think about that. I know that our Scottish Union Learning is doing a lot of work around using digital platforms and things for organising, and also our organising groups setting up a group looking at home working and how we can use digital technology for organising and trying to bring together some of the best practice in those areas. And just that thing about why should women not give up? You know, it's never been easy. It's always going to be a struggle, and as was said, you know, we're never going to get anything handed to us on a plate. We always have to fight for it, and now more than ever. And if we stop fighting, they'll take our progress away from us. We will go backwards. So, you know, please don't give up. If you're feeling downhearted, get together with some other angry women and let's build an army here and change the world.
Thanks, Roz. And as you can notice, it's myself as well. I'm not that digital and I'm just learning how to do all this. But it's like the questions and answers aren't coming up in mine. I don't know what's happened. So I'm going to ask Erin if she can get some of the questions up. I don't know if I've deleted them or done something like that, so I'm sorry. But could I ask Erin to come in, please, and see if she can give us some?
Yeah, I just because Brenda can't see some of the questions, I'll just read out some of the questions and then maybe the panel can just take it from there. So it's only 10-15 minutes to go. So read out the first one, which is from Joy Stevenson, who says that at the start of lockdown, we were told we couldn't cancel annual leave, but we had to take it. I had to remind the GMB or the GM that for some women, home is not a safe space. The policy was changed to take account for this. And there is a question in here about shared practice with risk assessment. So I suppose, Hayley, do you have any advice around shared risk assessments, particularly from that angle that you were talking about? There's another question for Wilma. So if you want to answer this, Wilma. So it says, Wilma Brown spoke about the long-term impacts upon nursing staff. What are feelings around the government's mentions of therapeutic services being offered? Is there trust in this? Is it accessible? Will care staff be excluded as they often privately employed? And I don't know if you want to answer that first, sorry.
Yeah, if you don't mind, because I'll forget the question as you go through all of those. I think there's a lot to be said about the government's promise of all of this work that's going to come forward and all of this money they're going to put in. Actually, what it actually boils down to at the moment is a national phone line, and that's not what we need. So what we've done locally, we were encouraged to set up staff hubs, if you like, and we've done them on the back of a fag packet and on a very shoestring budget, pulled together rooms where it's safe for staff to go to, because it might seem a bit precious, but sometimes staff do need a break away from an area that the public can also have a break. They need this privacy, they need to be able to be safe in their own space. So we've spent a wee bit of money and a lot of time pulling together these staff hubs within the health service. That's what we're encouraged to do. And they've been an absolute lifeline for our staff. They've been able to go there on their breaks. They've been able to shout and scream and swear if they want to. They've been able to throw things around. But more importantly, we've been able to give them a free cup of tea. And the amount of things that people have donated in terms of cakes and biscuits and Papa John's delivering pizza, all of that kind of stuff. We've tried to corral all of that into these hubs to make sure that staff can go and have a break and have a sit down. And obviously, as services have come to a bit of a standstill, for example, psychological services that would normally offer out patient appointments, these staff have not had the same level of impact. Obviously, they've been trying to do stuff on Zoom and all of that to meet with patients, but they've had a bit of downtime, so they've been coming into our staff hubs and they've been a direct link for staff. And we would like to see that continued so that the impact that this possibly could have on somebody's mental health is caught early, dealt with early, and staff are given that support exactly when they need it. So we've taken that forward. Everybody's heard about Sir Captain Tom Jones, Captain Tom, what's his surname? Forgotten. Anyway, he has raised millions and millions of pounds, which goes into the hospital charities. And just as an example, Fife were given a huge amount, thousands and hundreds of thousands of pounds from that charity, which we wanted to put into a staff endowment, staff hub type thing. But the Charities Act prevents us from doing that, because that actually is a core business essential that the organisation should be providing. So we're going round and round in circles at the moment, saying to the government, yeah, we've got the money, but we're not allowed to do that from the charities' money. But you're telling us we have to do it. So do we take that money out of patient care? No, we don't want to do that when we've got the money. And actually, can the Health Board afford to take services away from patients to put it in for staff? Equally as important, but a dilemma nevertheless. So we're going round and round in circles at the moment, and it's very, very difficult. But on a voluntary basis, we are continuing to provide that service for staff locally. But as time goes on and things get back to normal, will we be able to do that? And no, I don't trust the funding. I don't trust that the government are coming up with the goods that they're promising.
Yeah, that was great.
So the first one, sorry, was on like risk assessments, and is there any sort of shared practice? A few people in the chat are saying that they're actually embarrassed that they didn't even think about that from a risk assessment perspective. So if there's any panelists want to come in on that.
Anna, would you like to?
Sorry, were you going to? Sorry, Hayley, I don't know.
I was just going to say that having risk assessments, doing individual conversations with your workers in a kind of neutral sort of space, and allowing for a kind of gendered, trauma-informed place to address some issues, and like flexibility. So if all workers are working from home is not a good policy, because some workers will experience, you know, gender-based violence in the workplace. Some of them may be experiencing it at home. So it's that kind of extreme of one place being more safe than the other. So a flexible approach, that if some people are telling you, no, I really, really, really want to come into the office, even if there's no one there and there's no heating and, you know, it's, you know, not a nice place, I still really want to work there. There's probably a reason for that. So maybe have that conversation. And when you're asking about people, you know, not being able to work from home, if a woman is telling you, oh, you know, I don't have any privacy, you know, my partner's going to be around, dismissing that and saying, well, that's something you're going to have to overcome. Can you not just tell them to go into another room? Is not a sufficient response. Someone might not feel like they're in a place to be able to disclose right now. That might not feel safe. They might not be in a position to access support, or, you know, find somewhere new to live, for example. But what you can do is take their concerns very seriously, with that at the back of your mind, and be really non-judgmental and go into risk assessment not just with the view of how can I get this person to do work in the way that I want them to, but really taking into account that they're a person and that their preferences when they're talking about the best way for them to work might actually be about them preserving their own safety, and not just them being awkward or difficult or you know, any of these things that employers sometimes assume that women are.
Thank you, Hayley.
I'm just going to, oh, sorry, Brenda. I was just going to flag up a couple of bits of work that Close the Gap has been doing. So for the last couple of years, we've been piloting an employer accreditation programme in local government called Equally Safe at Work, which is focused on the employer role in preventing violence against women and supporting victim survivors in the workplace, and also taking steps to close the gender pay gap. And in response to, I think, specific questions there, we have done quite a bit of work with the pilot councils who, over the past year or so, and in fact up until lockdown happened, had been doing quite a lot of work on improving their employment practice, on supporting victim survivors of domestic abuse, of rape and sexual assault and other forms of violence against women. At the start of lockdown, we published guidance for line managers on how to better support women who are now working from home, which covers some of the, I suppose, picks up on some of the things Hayley was talking about, but in particular, how to do safety planning in this new working from home environment. It looks at risk assessment and how that might change depending on women's circumstances, but also just to look out for different signs that line managers should be aware of when women are working remotely, but also, I suppose, recognising that not everyone's working from home, as been mentioned before. We've also have other guidance that we've published as part of our resources that we do for SME employers, so they're focused on the private sector. And we have a resource on domestic abuse there for supporting employers to better understand what the experiences are of workers, women workers who've been affected by domestic abuse. And that in particular also has specific guidance for line managers in thinking about domestic abuse in the COVID context. So I can put those links in the chat for those who were in the question and answer actually.
Thank you, Anna. I'd like to just to say that the time has really went in quick, and there's still lots of questions to be answered, but as far as I'm aware, the STUC will be answering the questions and they'll be online. So just to say thank you for everybody for their contributions and for their assistance for myself in having this webinar. And I'd like to thank Emma, Wilma, Hayley, Anna and Roz. You've really done well. Thank you very much. And thank you to everybody who joined. And hopefully we can have some more webinars. Thank you, everybody. Bye.
Thanks, Brenda, for great chairing. Cheers.
Thank you.
Bye.
Bye.